Good evening, everyone. Can you hear me? I'm audible. आज हमारा हिंदी में है या इंग्लिश में है? टुडे इंग्लिश और हिंदी? या 2 March इंग्लिश, 3 March हिंदी. So dear friends, now we are going to discuss Master Tung Acupuncture. Few things about the Master Tung Acupuncture, and we will also discussing few very important treatment protocol of the Master Tung. So before proceeding, let's give the introduction of the Master Tung quickly. I will do very quick introduction of the Master Tung. Then I will tell you few very important protocol. So today I am thinking to share how to plan the treatment of autoimmune disorders, how to plan the very effective treatment for autoimmune disorders using Master Tung acupuncture. It is very challenging. If someone is suffering with autoimmune disorders, you might be aware with some name of the autoimmune disorders. Do you know any name of the autoimmune disorder? So there are many problems. I will give you few name of disease. Then you can also tell me. Like rheumatoid arthritis, very good, Sophia ji. Rheumatoid arthritis is one of the very important disease where our own immune system doing the destruction of the synovial membrane and creating the joint destruction and creating rheumatoid arthritis. So that is the autoimmune disease. There are many autoimmune diseases, but I will discuss which is very common. Another is ankylosing spondylosis or bamboo spine. We know many people are not able to bend, their spine are not flexible enough. Suppose I want to see this side, I will look like that. But if the person is having bamboo spine, stiff spine, ankylosing spondylosis, then if you want to see this side, he will look like that. The flexibility is not enough, but so we will see how to treat the ankylosing spondylosis when our own immune system creating inflammation in the spine and responsible for this problem, right? So there are many diseases. I will also tell few more name about the disease which are in the autoimmune nature. But first, let's give little introduction of Master Tung. So we can see this is the Master Tung, born in the 1916 and left this body in the 1975. Okay. And this is a very, very unique system which Master Tung learned from their forefathers. So this is the Master Tung lineage. So Master Tung was working in army. Okay. And after the retirement also and during the service in the army, he used to do the treatment using acupuncture. Generally, he was using only 2 to 3 needles for any patient. Master Tung also was using bleeding technique. Okay, so he was using needling. Also, Master Tung was using bleeding technique for some patient. We are telling bloodletting or we are telling hijama or blood cupping, whatever. but he was not using cup. Master Tung used to apply maximum 2 to 3 needles for most of the patient. Okay. Like nowadays we are learning TCM and many other therapies. We are applying many number of needles. Okay. In the Master Tung acupuncture, if we are applying 5 to 7 needle, they are more than enough. Even the 5 to 7 needles will create very good effect. Even I will tell you, many points we just stimulate with the help of acupressure, even without using any needle, and we can see very good results appearing. Okay. So this is a very effective system, and in this system, we will be learning autoimmune disorder today. Many students ask me they want to learn offline, they want to know how to insert the needle, they want to see how to stimulate the point. That's why we started doing many offline workshops. We just conducted in Jaipur. Now we are going to conduct in Mumbai, Bangalore, Chennai, and Hyderabad. So this that journey already started. But in between, I will keep sharing very important protocol to everyone. So today we are discussing this autoimmune disorder. Then we have discussed, then I told you, third disease, very common disease that is called thyroiditis. Because when someone is coming with a problem of thyroid, we are telling hypothyroid, hyperthyroid. So many persons are suffering with the enlargement of the thyroid, Hashimoto thyroiditis. Okay. And that is also autoimmune disorder when your own immune system killing your own thyroid gland. Okay. Now, type 1 diabetes, we know type 1 diabetes. In the type 1 diabetes, our own immune system killing the beta cell of pancreas. Our own immune system doing this. So person is not able to produce the enough insulin and suffering with type 1 diabetes because there is a destruction of the beta cell. Who is responsible for this destruction? Our own immune system is responsible for this. And there are many diseases of the intestine, like you have heard ulcerative colitis. Have you heard that name, ulcerative colitis? Ulcerative colitis. Are you aware with this name? It is also very common disease. Many people are suffering with this when our own immune system doing harm to our intestine and creating ulcer, and the person is having ulcerative colitis. Okay. So these are the disease. Now I will tell you very common disease. You know, psoriasis, skin problem. Psoriasis. Psoriasis is also the disease which is called autoimmune disease, and our own immune system is responsible for this. So today we will be discussing the protocol which will be very good for psoriasis also. One more very disturbing disease of the skin that is called white spot over the skin, or called vitiligo, or the white spot over the skin. That is also a very common disease, and if anyone is getting that disease, it not only suffering with the skin problem, but lots of mental, emotional problem. If someone is having white spot on the face, on the skin, or somewhere. So in this way, there are many diseases which is autoimmune in the nature, but with the help of Master Tung, we can work on this problem. We can arrest the unwanted hyperactivity of the immune system, because immune system is attacking in our own tissue. Autoimmune disease like this, suppose in your family there are 5 members, okay, but one member is harming the same family person. That is the autoimmune disorder. So autoimmune disorder means when your own family, some person from your own family is doing harm to others. That is the autoimmune disorder. So it becomes very, very important because body, we can tell in the simple word, our immune system is confused. Our immune system is confused. Okay. In that confusion, it harming our own body tissue. So that is autoimmune disorders. Okay. So when we want to treat any type of the autoimmune disorder, any type, always be first we have to start with the points who are very strong immune inflammatory regulators. I will repeat. We will start with the point those who are very strong immune inflammatory regulator means immune system creating the inflammation. Immune system is attacking some point who can be very strong against this immune system attack. Okay. So we have to apply the some very strong point who can be against of this unwanted immune action. Suppose in a family there are 5 members, one member is harming others. So we have to do something that member should calm down. That member should not harm others. Okay, so that is the main purpose of autoimmune protocol. So in this sequence, so first I will tell you in the Master Tung Acupuncture, the point is given in this way. There are multiple points in the fingers. There are multiple points in the palm. There are multiple points in the lower arm. There are multiple points in the upper arm. So Master Tung is telling, if the point in the finger, they are telling one number. If the point in the palm, telling two number. The point in the lower arm are telling three number. And the point in the upper arm are telling four number. So very simple. 1, 2, 3, and 4. This is the classification as per Master Tung. But Master Tung using any number 2 times, like they tell 1, 1. So when Master Tung is writing 1, 1, means double 1, means 11. 11 means he is talking about the point on the fingers. So they will tell, okay, 11.01, 11.02, 11.03, 11.04, 11.05. In this way, 5, 11.06, 11.07, 11.08 in this way. If he is telling 11 point something, means Master Tung is telling about the point on the fingers. And if Master Tung is telling 22 number, 2 means 22. Like 22.01, 22.02, 22.03, 22.04 means Master Tung is telling about the point on the palm. 22. Here 33, 33.01, 33.02, 33.03. There are 44, 44.01, 44.02. So the numbering is very simple in the Master Tung. Very simple. In the same way, if we go in the feet, so 4 over here, 1, 2, 3, 4, or we can tell 1, 2, 3 and 4. Now, if we talk about the feet, अगर हम पैरों की बात करें, so in the feet, any point located here, that is 5 number. So 55.01, 55.02, 55.03, 55.04 in this way. Anywhere in this plantar surface, anywhere. And the point here on the dorsal side, 66.01, 66.02. So there are six numbers. 5, 6, 7, and thigh will be 8. Okay. So 55.01, 55.02, 66.01, 66.02 in this way. Here 77.01, 77.02, 77.03, 77.04 in this way 77 series will go. And here 88.01, 88.02, 88.03, any point whether here or here or here, anywhere in the thigh, that is 8 number, 88. Then the point in the ear, 99, 99.01, 99.02 in this way. And finally, the point in the scalp means head region, that is 10 number. So 10, Master Tung also writing 10 two times, 10, 10. So 10, 10.01, 10, 10.02, 10, 10.03 means the point available here. So the very simple classification of the Master Tung, 1, 2, 3, 4, 5, 6, 7, 8. Then 9, and this entire head region, which include head, face, and everything other than ear, that is 10. Okay. So now, as per this concept, if there is an acute disease, choose the point in the upper body. If there is a chronic disease, choose the point in the lower body. This is general formula. Suppose someone is having acute cardiac arrest. Someone is having acute pain. Someone is having acute skin inflammation or acute psoriasis. If the problem is very acute, if the problem is very sharp, if the problem is very new, choose the point in the upper body. But the problem is very deep and the chronic and the old and deep and the internal, then choose the point in the lower body. Can you tell me autoimmune disorder is the new problem or the old problem? What is the autoimmune disorder? Autoimmune disorder is very chronic, very deep, very old problem. So we will choose the point in the leg area. In the leg area also, if you see my leg here, this is the most deepest part, the most deepest part. With the help of here, we can treat the most deepest problem, like the very deep and chronic problem of the heart, the deep and the chronic problem of the liver, the deep and chronic problem of the brain, the deep and chronic problem of the digestion, the deep and chronic problem of any body organ from the thigh. So leg is for chronic, but out in the leg also, if you further go here, this is treating very deep and the chronic liver problem. So in the autoimmune disorders, we will always start our journey from the points over thigh. Then we are having points a little bit here and there also, but the point over thigh. That is the starting of journey. Okay. So now first I will select the point, the strong point, or I will tell the point who can take the strong action. And the immune system should not bother, should not attack anywhere. So now I am telling you the very important point of Master Tung, that is called leg rapid horses। इन पॉइंट का नाम क्या है जो मैं भी बता रहा हूं? इन पॉइंट का नाम है leg rapid horses। Point itself, the name is very wonderful. So I will show you here. Let's see this image. So if you look at this image, we can see, I will tell you the exact location of this point. Right now we can see here the 88.17, the 88.18, and the 88.19. These 3-point unit is called leg rapid horses. All the 3 points are located on the stomach meridian। ये हमारे तीनों के तीनों पॉइंट कहां पर लोकेटेड हैं? हमारे स्टमक मेरिडियन पर लोकेटेड है। एंड स्टमक मेरिडियन इज द मेरिडियन who is supplying the anterior part of the human body। And if you look at the root of the stomach meridian, अगर आप स्टमक मेरिडियन का रूट देखें, we can see in this image। So if you look at this image, this is the stomach meridian starting from the point below the eye, and then it's supplying entire face going to the head region, then stomach meridian crossing our throat area, supplying the chest, breast, supplying the entire chest area, supplying the heart, lungs, entire chest area. Then it's crossing the stomach area, crossing the stomach. Now it's going in the genital part, it's crossing the uterus, it's crossing the genital part, and it's going in the leg, further crossing the knee and going downward, ending on the second toe. It is a very big meridian. So now we have to look at the 3-point on the stomach meridian. In this route only, we have to look at just a 3-point. Point number 1, point number 2, and point number 3. Master Tung told this is the 88.17. So Master Tung has given the name like 88.17, 18, and 19. So 1 is the center point. So 1 point is 2 chun above and 1 point is 2 chun below. So there are 3-point unit which is called leg rapid horses. Give me 1 minute. I will show you with a more clarity so you will understand. So look at this quick video where we have done the demonstration of this point. We will show you one video if you are not able to understand. Let's see here. So now we are going to discuss next point, 88.17, which is in the thigh region. So 88.17, 88.18, and 88.19, these 3-point units are available in the thigh region, and the name of these 3 points are rapid horses. So like first we will get 1 point, that is 7 tune up from the lateral angle of the patella. that will be center rapid horses. Then tuchun up, that is upper rapid horses, and tuchun down, that is lower rapid horses. So in that way, that 88.17, 88.18, and 88.19, these 3-point unit work very nicely for all types of skin and lung problem. We have another way to reach these points. If we touch fingertips here, so this is gallbladder 31, and if we come, so gallbladder 31, so this is the gallbladder 31. Now from here, if we come Trichun anterior, so this we will get here. This is our 88.17. Or we can go from lateral angle of the patella. So this is Trichun, and Vanchun. So again, we are reaching on the same points. This is 88.17, center rapid horses. Now Tuchun up. This is upper rapid horses, and Tuchun down. This is lower rapid horses. Because as per the imagination, if we imagine full body here, so this is head region, this is chest region, and this knee is representing umbilical region, so like that. So if this is chest region, so all the lungs problem can be treated from here. So these 3 points are treating all the problem related to the lungs very nicely, like pleurisy, tuberculosis, pneumonia, bronchitis. These problems can be treated very successfully by these 3 points, as well as all the problem which is related to the skin, like psoriasis, eczema, and all different types of dermatitis can be treated from these 3 points. And we can needles very deep, for 1 to 2.5 to deeper needle at this point. So you see, this is needle. So how to put? First, we will put the center, pump it. So this I have. This is two-tune insertion. This is upper rapid horses. Again, this is two-tune insertion. And this is lower rapid horses. So in that way, we can treat all the problem like that, and we can put these points bilaterally. So I'm putting other side also. Now this is only one needle. One, that's 88.17, 88.18, and 88.19. So the time of retention at least 30 to 40 minutes. So these points are very successfully treating lots of problems related with the skin allergies. If there is a discharge from the skins, like interstitial media, pus coming from the ear, and like pus oozing from any part of the body, like from any wound. So we can treat with the help of these points. Okay, done. So now we in this video, what we have seen in this video, we have seen the leg rapid horses, because these points are on the stomach meridian, and we know the stomach meridian is crossing this. So mainly we are treating the lung. It means we are treating the skin problem. We have seen in my many of my friends, myself, has applied leg rapid horses and treated multiple skin problems, psoriasis, eczema, successfully. Because when we are putting the leg rapid horses, what we are doing, we are targeting lung, and with the help of these point, we can improve the lung. Once we can improve the lung, as per acupuncture, skin is coming under the lung. So if any of your patient is suffering with any type of the skin disorders, like very chronic and the deep rooted skin problems, then it is a very good choice. You have to apply the leg rapid horses. But if it is new problem, new skin problem, if it is the acute skin problem, new skin problem, it's not the deep, it's not the old, it's not the chronic, it's not like a psoriasis, it's a very new problem. Then we have to go for finger rapid horses. So remember one thing. I told you the finger rapid horses are the point in the upper body we use for acute problem, for the new problem, and the point in the lower body will use for the chronic problem. So these points are very useful for any type of the skin problem, whether the fungal infections or the when there's too much kapha in the lungs, then it is creating infection, inflammation in the middle ear, and it's disturbing our ear. then it disturbing even entire ear. Even the person start getting giddiness and vertigo, sometimes pus for coming out from the ear. In these all condition, we can try leg rapid horses. If your location is correct, in 3 sittings, you will see results are starting. In the 3 sitting, you will see something changing. Even before that, you can see if your location is correct. These points are very, very effective. Anyone has tried this point from you? किसी ने ट्राई किया? Deepika ji, have you tried this one? Very wonderful. Okay, okay, that's great. So now we are coming back to our point. It's very good for white patches, very good for skin disorders, white patches or the vitiligo, leukoderma, and very good. Like if you want to treat the allergic problem, for the allergic problem, you have to include liver also. Remember. But right now, my aim, I was discussing with you about the autoimmune disorders. So now I will be moving to the second point, which will be very much useful if we want to treat any type of the autoimmune disorder. Because I told you that we are going to discuss autoimmune disorder. Autoimmune disorder where our own immune system, our own defense system creating the problem. Okay. There are many diseases. You might have heard about multiple sclerosis. आपने सुना होगा ना, multiple sclerosis. And there are many bigger diseases like myasthenia gravis. नाम सुना है आपने multiple sclerosis का या myasthenia gravis का? नाम सुना होगा. Do you know what is multiple sclerosis? What is myasthenia gravis? Okay. There are many diseases. Guillain-Barré syndrome. What is Guillain-Barré syndrome? GBS. So what is happening in these all diseases? Though, like I will tell you, multiple sclerosis. Multiple sclerosis. What is happening? Our immune system attacking on the brain, on the neuron. Suppose I will give you an example. This is the neuron. ये neuron है. This is the neuron in the brain. Like if you see this wire, in the wire, what is there? If I touch the wire, I can recharge my mobile, I can recharge my phone. But even I am holding here, I will not feel current. Why? Why I will not feeling current? Can you tell me? Because of this sheath, sheath outside the wire. In the same way, outside the neuron, we are having one sheath that is called myelin sheath. Myelin sheath. Very important. Okay. If the myelin sheath is there now, the nerve message jump from nerve very fast. Myelin sheath like we can just do the imagination like a spring. Suppose myelin sheath is like a spring in the neuron. If the any message is coming because of the myelin sheath, it will be pumped very fast. It is very pumped very very fast. So myelin sheath is very important in any neuron. But sometimes what are doing? The immune system is damaging this sheath, myelin sheath. Immune system will destroy, destruct, remove the myelin sheath. Like if I remove this outer sheath, that is multiple sclerosis. So what is multiple sclerosis? When our own immune system attacking on the brain, attacking on the spinal cord, and attacking on the myelin sheath, which is the protecting covering of the nerve. So myelin sheath get damaged. We are also telling demyelination. Okay, now what is happening? Nerve signal will go very slow. nervous signal are passing very, very slow. Okay, this is the multiple sclerosis everywhere, because when I want to work, I want to walk, my brain will go order. Okay, lift your leg, now go little forward, then I can walk. If even I want to move my eyes right side, my brain is giving order to my eye muscle. Okay, move the eye to the right side, move the eye to the left side, take the eye up, take the eye down, rotate the eye. I want to do any movement, the first brain will order. But now what is happening? This path become very slow. I cannot walk because order is coming very slow. I cannot balance. I cannot see properly. I cannot coordinate in both eyes. There is a blurred vision. So in the one word I will tell you, when multiple sclerosis means when our body defense system attacking on the insulation. This is the insulation of our nerve. So now there are many diseases like myasthenia gravis, like the multiple sclerosis. We cannot forget brain if we want to treat the autoimmune disorder. Can we forget brain? Can we do the treatment without you brain? No. How to treat the brain? In the master of acupuncture, if you want to treat the brain, you treat the liver. Liver means you just think you are treating the brain. If you treat the liver, you are treating the brain. Why? Because pericardium and liver belong to one family, that is called zoo-in. If you treat the pericardium, it will work on the liver. If you treat the liver, it will work on the pericardium or the brain meridian. So I am doing the treatment on the liver meridian. Liver meridian is here. Liver meridian is here, inside the thigh. Outer side is gallbladder, inside is liver. Inside. Exactly in center of the thigh. Exactly in the center of the thigh, there is a liver meridian. So I have to treat the liver meridian. As soon as I treat the liver meridian, then this liver meridian will go to the center of my brain. So for the any type of this disease, I will again choose the 3 point. In the same way, how I selected the 3 point in the stomach meridian, now I will select the 3 point in the liver meridian. Because these 3 points are very, very important. That's why in the master tongue acupuncture, they have got a very important name. मास्टर टंग में इनको बहुत ही महत्वपूर्ण नाम दिया गया है. अपर थ्री येलो इनका नाम है. अपर थ्री येलो. येलो यानी येलो मीन्स पीला. अपर थ्री येलो. You can see in this image. I will show you one image here. Like look at here. We have to select the 3 point in the liver meridian. 1 point in the center, then 1 point above, and 1 point down. Got it? हमें ये 3 point लेना है. So how to select these 3 point in the liver meridian? I will show you one video so that you can understand with more clarity. Because the upper three yellow, if you know the upper three yellow, you can treat any type of the brain disorder. These points are located on the liver channel and they are very good for brain. ये हमारे liver channel लेकिन ये ट्रीट करेंगे ब्रेन को। लेट्स सी नाउ। From the midpoint of the knee, if we follow this line, this is the liver meridian. Or we can go in another way. This is the gallbladder 31. If we go just opposite to gallbladder 31, this is the liver meridian. We have 3-point unit here on the liver meridian. The name 88 point, 12, 13, and 14, 88.12, 13, and 14. So now, first what we'll do, we will put a 1 point at the level of gallbladder 31, but just opposite side. Okay, so this is the first point at the level of gallbladder 31, just opposite side. And 2 point, we will put 1 point 3 chun down and 1.3 chun up. So these are the 3-point unit. These point very wonderful for liver. Number one, if someone is suffering with fatty liver, with cirrhosis of liver, with any condition of the liver, hepatitis, hepatomegaly, very worst condition of the liver, these are the wonderful point. Upper 3 yellows. Second, if you put point here, this will cure the back pain of the opposite side. If you point here, this will work on the back pain, this side. So these points are very good for back pain. Number 3, these points are very wonderful for Parkinson, because with the help of these points, we can enhance the hypothalamus for increasing more dopamine. These points are very good for blood cancer and leukemia. If someone is suffering with the WBC high count, it should not be more than 11,000, but 50,000, 30,000, 1 lakh. If someone is having blood cancer issue, we can use these points. These are very wonderful points for the blood cancer or leukemia. And these points are very good for multiple sclerosis. It is brain disorders. Multiple sclerosis. So these points are very good for Parkinson, multiple sclerosis, leukemia, liver pain, liver problems, fatty liver, cirrhosis of liver, and back pain. Both liver enlargement. It is wonderful for all the liver problems, including liver enlargement. So this was a quick demonstration of these 3 points. Actually, I'm showing you the video which we have taken during the offline works of the master talk. Okay, so a few videos we have taken during the offline workshop, and which is very helpful. Is these videos are helpful for you? Are you able to understand? Okay, so we are taking middle point near what? 7 chun above. Middle point 7 chun above. Okay. So if this is the knee, so from the knee, if we go 7 chun above, so this is the 3 chun, and 1 more chun, this is the point. Okay. Or we can also think like from here also, in the stomach meridian also we have taken the point 7 chun above, 3 chun, and 1 chun, when we were discussing about the leg rapid horses. So the middle point will be at the same level. Once we get this point, which is 7 chun above on the liver meridian, this is in the side. This is not in the front. This is on the side, exactly in the center of side. Then from this point, we have to take 3 chun above and 1.3 chun down, these 3-point unit. These 3-point unit are one of the very good point combination, because these points are located on the liver meridian. So definitely they're the very good for liver problem, very good for fatty liver, cirrhosis of the liver, any type of the liver enlargement, liver problem. But because the liver meridian having connection with the pericardium or the brain meridian, so these points are one of the very good points for any type of the brain disorders, like meningitis, encephalitis, migraine headache, or Parkinson, any problem which is having connection to the brain, or the multiple sclerosis, or the cerebral palsy, or memory loss, Alzheimer's, whatever problem having connection with the brain, these points are very good. So I will tell you mainly 3 indications. Number 1, it is very good for liver. Number 2, these points are very good for brain. And number three, these points are very good for cancer. For the cancer, any type of the cancer in the human body, whether uterine cancer, prostate cancer, liver cancer, intestinal cancer, cancer in the buccal mucosa, brain tumor, blood cancer, or the leukemia, any type of the cancer, we will definitely use this point because in the cancer, the cells are spreading all around. We have to arrest this. We should do something so that cells should not spread all around. We have to use the liver because liver meridian is responsible for spreading the thing around. Liver meridian is responsible. Okay. So in this way, these 3-point unit are very important for these multiple problems. Okay. So in this way, this was the second point which we have discussed. First, we have discussed leg rapid horses, and second, we have discussed this point. Now, I will just tell you the third and the most important point for all type of the autoimmune disorders, that is called Sanchcha Sun. Sanchcha Sun. So now we have to move in the first. I will show you here. You can see this is the fourth and the fifth finger. In between the fourth and fifth finger, we can see this is the gap. If we stimulate this area, then this is called Sanchcha Sen. In the Master of Acupuncture, this is the name like Sanchcha. This is the name Sanchcha Sen. Or we can consider, we know the triple worm meridian going from here. This is the triple wormer 1, triple wormer 2, triple wormer 3, triple wormer 4. So we have to focus on the triple wormer meridian. And if we stimulate this area, अगर हम इस एरिया को स्टिमुलेट करते हैं, we can put the one needle here, or we can put the deep needle inside and drag from this point, and it will go like this. Okay. I will do demonstration of this needle in the tomorrow class. So this is our next point, which is located on the triple worm meridian. The triple worm meridian, who is supplying the energy in the upper wormer, in the middle wormer, in the lower wormer. Triple wormer is the meridian who is supplying the energy in the lower wormer, so controlling genital energy. Supplying energy in the middle wormer, controlling digestive energy. Supplying energy in the upper wormer, it is controlling endocrine energy. That's why in triple worm meridian, also called endocrine meridian. So this is a very effective point that is called Sanchcha Sen. It is very, very effective point here. So this is the point, Sanchcha Sen. We are putting the needle here and we will drag the needle inside till here. Or we can put one needle just here. We can put the one needle here, or we can put the needle in the babe margin and bring till here. This is the Sanchcha. This is the stimulation of Sanchcha Sen point. Whether any type of the autoimmune disorder, whether we talk about the thyroiditis or the diabetes type 1 or the multiple sclerosis, or there are many other diseases, you might have got Guillain-Barré syndrome. Have you heard that name? Guillain-Barré syndrome? GBS? No, you did not. Okay. No. Okay, no problem. Right now, we will not discuss about that disease, but those many of you have got the patient like that. They know that. What is the GBS, Guillain-Barré syndrome? If we make a very good plan for these all type of the autoimmune disorders, then we can create very good results. Okay, I will write the name in the chat box. You can write GBS. GBS. Okay, actually some student asked me Can you discuss about the Guillain-Barré syndrome? So that's why I am telling this name again and again. That's why if they can also get some idea that how to treat this. Okay. इसको मैं एक्सप्लेन करूं क्या होता है. Guillain-Barré syndrome एक वो बीमारी है. Guillain-Barré syndrome is the disease when our immune system is attacking on peripheral nerves. हमारी खुद की जो पेरिफेरल नर्व होती हैं उनके ऊपर इम्यून सिस्टम आक्रमण करता है. अब पेरिफेरल नर्व क्या होती है ये आपको पता होना चाहिए. व्हाट आर द पेरिफेरल नर्व? Okay. If you know the peripheral nerve, then you will understand this. Do you know what is peripheral? There are two types of the nerve. One nerves, जैसे एक ये पेड़ है, this is a tree, and the other branches of the tree. So this is the brain and the spinal cord. In the brain, we are having too many neurons. In the spinal cord, we are having too many neurons. And many nerves are there in the brain, and many nerves are there in the spinal cord. But many nerves are going out from there. Many nerves are going out, then supplying the different body part. जैसे कोई भी नर्व होती है वो कहाँ से आती है? Any nerve coming from the spinal cord or the brain. So when, like you're telling sciatica nerve coming from where? It is coming from lower spine. In the same way, some nerve supplying the stomach area, they are coming from the spine. So when our immune system attacking on the peripheral nerves, that is called Guillain-Barré syndrome, then person will be just collapse on the bed, fully paralyzed. But still we can treat, and some patient can respond very nicely. So what we have to do, we have to use leg rapid horses, we have to use 3 yellow point, and we have to use Sanchcha sun. These points we have to use, and remaining discussion we'll do tomorrow. Tomorrow is a Hindi class. I will repeat this, and probably if something left, I will discuss little more about that. तो कल हम इसी को रिपीट करेंगे. कल भी हमारा हिंदी का क्लास है, हाउ टू ट्रीट द ऑटोइम्यून डिसऑर्डर यूजिंग द मास्टर टंग एक्यूपंक्चर. सो नाउ इनफ फॉर टुडे. आज की क्लास को हम यहाँ पर विराम देते हैं. एनी क्वेश्चन टिल नाउ? Okay, you want to unmute yourself? Yeah. Yes. Where Neelam ji? Where are you? नीलम जी कहाँ पर हैं आप?
नमस्ते सर, बहुत ही अच्छा लगा. हम आपकी राह देख रहे हैं बम्बई में बहुत ईगरली. सो जल्दी से आ जाए. और सर ये जो है ये अपना स्किन में जो फंगल इन्फेक्शन वगैरह होता है उसमें भी काम आएगा. पिंपल्स होते हैं और फंगल इन्फेक्शन उसको ही हो जाता है.
So I will tell you, वो दूसरा वाला दो. हाँ, अब मैं बोल रहा हूँ. So if the person is suffering with a fungal infection, any type of the fungal problem, so definitely leg rapid horses are very good point. But no need to make the full treatment of autoimmune disorder, because they are not autoimmune disorder. They are skin disorder. So we can treat just by the leg rapid horses. Leg rapid horses will give very good. If the acute problem, so we can't discuss finger rapid horses point right now. Okay. See, point, we can't discuss finger rapid horses right now. But I'm telling you, the acute problem, we can treat the finger rapid horses. But the chronic problem, most of the time, is skin problem or chronic problem. And just by the leg rapid horses, we can treat very nicely. Yeah, you can try this. Yes, Neelam ji.
Yes, sir.
Haji.
Sir, am I audible?
Yeah, you are audible. Please tell me.
Sir, I just wanted to ask one thing. Girl at the age of 12 suddenly developed type 1 disease. She was fine till 12. And then suddenly she developed this, and the doctor said that it is at the time of puberty that she developed type 1 disease, type 1 diabetes. Now, any patient that has been cured from type 1 disease like this by you?
You're asking type 1 diabetes?
Yes, sir.
Actually, type 1 diabetes is very complicated problem, and sometimes it's really very difficult to treat. But in the type 1 diabetes, which is the protocol which can give you good results. Number one, I told you like rapid horses. Number two, three upper three yellow. Or number three, lingu and dabai. And number four, Sanchcha. I will repeat. So today what we have discussed, today we have discussed 3 points. So number one, we have discussed leg rapid horses in the stomach
Hmm.
meridian. Number two, we have discussed upper three yellow in the liver meridian. Number three, I discussed Sanchcha. Just you have to add the lingu and dabai because lingu is here. I will post one video after this class. I will post one video where I
हाँ.
have done the
सर हो
demonstration of the
जाता
lingu
है
and
कि
dabai because lingu point is a very good point who remove stagnation. Who remove
ओके
stagnation. So when there is our own immune system attacking on the human body, with the help of these 4 point combinations, we can treat multiple autoimmune conditions, including diabetes type 1. But the diabetes type 1 is little complicated disease than the diabetes type 2. And but we can create the results, and we have to make a like plan, very proper plan, like you make the plan, correct the diet, do the treatment, and you can make a full plan accordingly, then definitely you can improve the condition. And I will tell you, I will not use cure word, but I can use, we can improve the condition. We can bring better condition what is currently with the
but sir
patient.
she was all right when she was born. She was
Hmm?
perfectly all right when she was born. She was perfectly all right till
No,
12.
I'm telling you about the current condition.
Okay.
Current condition suffering with the diabetes type 1.
Hmm.
So many person are getting diabetes type 1 at the age of 17 years, 20
Hmm.
years of the
Okay.
age. One female patient, she was very healthy, good, there is no any issue. Suddenly at the age of 17 or 18, she got diabetes type 1.
Okay.
So it is not necessary the diabetes type 1 will be always with the birth. It also might happen after some time, after some age.
Okay.
Yeah.
सर आप सर वीडियो दे दीजिएगा आपकी.
हाँ मैं लिंक डालेगा वीडियो आपको ये स्माइली जी
Good evening, sir. The class was very good. Sir, I wanted to ask, we have these hereditary diseases. No, now we're talking about old diseases and new diseases. Like hereditary diseases, we have, let's say, for example, autoimmune diseases or diabetes or sometimes cancer also. They say it is coming from hereditary. Such problems also can be treated, sir?
no I'm just talking about the autoimmune disease.
Okay.
The treatment of the cancer is entirely different, but I told you the point on the liver meridian, they are definitely useful for the cancer patient. In our
Okay.
protocol these points also will be there, but what am I discussing today, this is purely for autoimmune disorder.
Okay. No,
Autoimmune
that is
disorder.
what, sir.
But I'm telling you, like liver point can work on liver also. Then point I selected leg rapid horses on the stomach meridian. They will
Yes,
work
sir.
on the lung and skin also. Okay.
Okay. Okay, sir.
But for cancer, like in the master Tung workshop, we are discussing few point in the feet,
Okay.
like and a few point in the gallbladder meridian. In the same way, cancer protocol is a little different.
Okay, sir. Even though if it is hereditary also, that it is cured, sir?
Yeah, definitely. If we, even because even it is heredity, I never use cure word. I always feel good that should use improve word, improve.
Okay, okay.
Because see, all the problem are not same. We don't know what is the depth of the problem.
Okay.
So our target, okay, let's improve. Okay, whatever condition right now, after my every sitting, you will improve. Okay,
Okay.
so that is our target. Okay, someone is telling, okay, can you treat? I am having number in my eyes. Can you treat? Yes, I can treat.
Okay.
I can improve. Okay, I can improve. So if the person is having 10 number, I can improve till the 7 number, 6 number, or 8 number, or 5 number, whatever. If the person is having 2 number, I can improve 1.5 or 1. Okay, both patient having different, both patient is having eye problem, but the depth is different. So
Yeah.
better use improve. Okay. Yeah.
Okay, sir. We can treat glaucoma also, sir.
Yeah, successfully. Glaucoma we can treat. Yes.
Okay.
Very
Sir,
good
one
point.
more question is, in the toes, we get fungal infection in the toes and we get corns, no, sir? That is due to what, sir? It is also skin disease, dryness of skin, sir?
Yes, we can consider under the skin disease. And if we make the skin protocol, we can treat them.
Okay. Thanks a lot, sir.
Welcome. Yes, Ajay ji.
Hi sir, namaste.
हाँ नमस्ते.
Left side, same stomach meridian. He had itching, too much itching. Can we use two side? That rapid horse.
Okay, so if it is the person is having acute itching, acute condition, then go to the fingers, because in the finger we are having finger rapid horses.
Sir, he had
But
2 months before he get that, but now also he
so
had.
yeah, if the person is having some skin problem and you think the same area is difficult to needle, then we can go in the other leg. If the
Okay.
person is having problem in the left thigh, we can go in the right thigh.
Okay, sir. Thank you.
Yeah. Regarding the neuropathy definitely we can use the Dr. Jyotika ji. For the neuropathy, we can use leg rapid horses, but I will tell you one more thing, because you already know the location of point of the master tongue. So for the neuropathy, very good point in the feet, in the dorsum of feet. You already know, so I'm telling you the number 66.06 and 7 are the very good for neuropathy. Okay. So definitely these point can be used for nerve problem. Yeah. Okay. Okay. Yes, Jagrati ji.
Hello, sir. Happy to see you again. Sir, you mentioned about the allergic conditions we have to use liver points. So that is the upper three yellow points that you said. Along with leg rapid horses, we have to use liver
Yes,
point.
so I will tell you, allergy means in the allergy there is a liver aggressively involved. Okay.
Huh.
When any type of allergy, liver is aggressively involved. So what we
Okay.
have to do, we have to calm down the liver. Why
Okay.
we have to calm down the liver? So there are many points like bleeding the ear apex, or maybe we are having like definitely you can use the point in the thigh. That is also the very good point for liver. And there are many other liver point which will calm down the liver, which will sedate the liver. Like the liver
Okay.
too will sedate the liver, calm down the liver. So in this way, allergy means the liver is very aggressively involved. So we have to reduce the aggression of liver in any allergy, like
Okay.
whether it's the allergic skin problem, allergic running nose, allergic cough and cold, any type of allergies. In the master tongue
Hypersensitive
acupuncture,
pneumonitis.
in the
So, for
master tongue
example,
acupuncture, there are very good points,
hypersensitive.
11.17 for
Okay.
many allergies, 11.17. Okay, you can note down and you can see, you can Google and you can see it, right? 11.17. Very good point.
Okay. Thank you, sir.
Yeah. Yes, Subramaniam ji.
Nice class before workshop, sir.
Yeah.
Thank you, sir.
Thank you.
Sir, will we be having today or tomorrow Dr. 10
No.
remaining classes? You said, no? When are we planning, sir?
I will tell you that group, not
Okay.
here. Okay.
Okay, sir. No issues, sir. Sorry to trouble you.
Okay.
Thank you, sir.
Yes, Janice ji.
Sir, with this Tung acupuncture, this thing, what's the frequency of the treatment that we give? I mean, daily dena hai ya alternate days?
We never give tongue treatment every day because this treatment is very effective. And once we needle, the effect of these energy is there in the body for minimum 72 hours. So if you are needling again before the 72 hours, we are disturbing the harmony of the body. So it's always better do the treatment after 72 hours. So do the treatment today, then do the break of 2 days, then give next treatment. Or it is not possible for you that doing the break of 2 days, then do the treatment break of day 1 day at least. But
Alternate days.
break is mandatory if we want to bring the very good effect in the minimum number of days.
Okay. Thank you.
Yes, Sophia ji.
Hello. Good evening, sir. Am I audible? Hello. 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 Good evening, sir. I wanted to ask one question. Am I audible? Okay. So, sir,
Hello, Sophia ji.
good evening, sir. Really, very nice to see you after a long time. I wanted to ask one question, sir, regarding keloids. Will this 88.01 and 2 and 3 will work? The leg rapid horse? It is a very old one.
Yeah. So I will tell you, keloid is a very complicated disease, number one I would want to tell you. But we can improve the condition of the keloid, and these points also very good for keloid.
Okay.
I will not tell you that we can cure the keloid.
Okay. No, but the little bit of the
But definitely,
shrinking of the size.
yes. We can definitely work on the keloids because
Okay.
keloid also it's very because this leg rapid horses working on all the 7 layers of the skin.
Oh, really? Okay.
Yeah. So that's
That's
why.
good. Yeah.
Yeah. So we can definitely you should try these points.
Yeah. Thank you so much, sir.
Yeah.
Appreciate. Yeah.
Yes, Sarabjit ji.
सर
हाँ
ड्यू टू ईचिंग ना स्किन का कलर बदली हो जाता है, मतलब यहाँ पे
हाँ
ब्लैक नहीं होता है, यहाँ पे थोड़ा सा लाइट शेड हो जाता है जो स्किन का है उस कंपेयर करेंगे. देन हाउ टू अंडरस्टैंड दिस दिस इज एक्यूट.
No, this is the very chronic problem. Like this is one
But
type of
it is,
pigmentation only.
yeah.
Pigmentation only when your skin become little darkish complexion. It is not black, but this is the problem because we are having 7 layers in the skin, and this type of the skin problem when skin become black, not exactly blackish, but black, little lighter black. This is the problem of the deeper layer of the skin, deeper layer. But definitely we can improve the skin complexion with the help of leg rapid horses. Even the master tongue acupuncture, there are many other points also working. But right now I am telling leg rapid horses because this skin problem is also very deep internal and chronic type. So this is the best option to choose these point.
We can use this na finger rapid horses as it
Yeah.
is, we felt it is acute है, अभी आया है, as but you are saying it is chronic.
No. अभी आया है?
हाँ, अभी आया है, like 1 week, 2 week, 1 month, अभी recently appear हुआ है.
Then I will tell you if it is on the face. So the very good point for improving the facial complexion, removing unwanted pigmentation, removing unwanted blackish formation from the face. So number one, we have to use finger rapid horses. I will tell you now. I have to tell the location because the many of you asking.
Yes, sir.
And the second,
dark.
wait.
Okay.
The 2-point combination, 11.07 and 11.17 are very good point for females because they are improving the facial complexion in the female, because these problems might be because of the hormonal dysfunction, and with the help of these 2 points, so finger rapid horses will be here. You can also do the Google and you will find here these 3 points are the, I will also share you in the Mumbai class. These 3 points are the finger rapid horses, and these 2 points are the 11.17. Just with the help of this combination, these 2 points and these 3 points. Right now, I'm not sharing these points fully, but I'm telling you some idea that if you apply this, if you know the perfect location of the 11.07 and the 11.17, 07 and 17, you try this and it will improve the facial complexion. Got it?
तो ये
We
अगर
have to use
प्रॉब्लम
only
नेक
in
की
the, try only in the one hand
या
only. Yeah.
सर ये नेक के पीछे हुआ तो भी यही माने कि हम
अगर वो नेक, या अगर नेक के पीछे होगा तो भी वही बात है.
ये
Any
वन
way.
शेड सर डार्क लाइट हुआ है, डार्क नहीं हुआ है,
Yeah,
स्किन
yeah.
से लाइट हुआ है.
Okay. So that is the, because in the this type there might be involvement of some hormones also, because hormones also responsible for very beautiful skin. If there is a disturbances in the skin, we can improve the hormones and the improve the beauty with the help of these 2 point combinations.
Sir, if this is due to the medicinal side effect,
Then also it will work. This point is very good. That is the bull
okay,
angle.
17. Yeah. Okay. Thank you, sir.
Okay. So regarding the many other point, like I told you, 66.067, I can't discuss right now because I told her, because she already joined our mastering workshop in Jaipur, she know the location. So I told you, but it's very difficult to tell these points right now, because it need lots of, like I have to show sequence of the point, 2 points in the center. It will require great effort. So the question asked by Dr. Jyotika ji, she was already present in the master doing class Jaipur. She knows. So I just shared 66.06 and 7. So now we will close the session today. If you have more question, you can put in the group. I will reply in the group directly. Okay. And I will also put the image. If I think if you're feeling some difficulty to understand the point, now we will see you tomorrow. Tomorrow we'll do class in the Hindi and with some little add-on. Okay. So thank you so much. Let's close the session.